Well, and built into that anxiety is the assumption that catching it earlier means you do better. And that is an assumption. It's a hard one to ignore, because the overwhelming sense is the sooner you catch it, the less likely bad things are going to happen. And on the whole, that's certainly true. But when someone's heavily monitored, the every 3 to 6 month recommendation that your doctor provided you didn't come out of thin air. Like that was evaluated to say, how frequently do you need to monitor people? And then, if something's slow growing, if something's pretty indolent, meaning like a non-aggressive cancer, you were identified at stage 1, a small cancer, they cut it out, they thought they got it all. Is the extra growth of 3 months versus 5 or 6 is if you were to have missed it, so to speak, if you didn't do that scan, is that extra growth meaningful, or do you just radiate it anyway? So it's an interesting conversation that we have around this kind of stuff. It's a lot of times the real reason we're doing these extra things is to alleviate anxiety, even when we think the extra time isn't going to change much, or that at least the likelihood that the outcome would be worse is low. So really, you're alleviating anxiety for the most part. And the flip side of that, the irony of that, is the extra testing that we're doing to try to alleviate anxiety is worsening the anxiety.
I really feel that. And that's why it's a catch-22 for me.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit CrackingCancer.org to join the Cracking Cancer community.